Hi everyone, my name is Bennion, and this poster presentation discusses my PhD project titled Enhancing Engagement with Between Session Work for Low Intensity Cognitive Behavioural Therapy Based Interventions. The effectiveness of CBT can be considered as the extent to which patients are able to transfer skills learnt in treatment sessions into those adaptive changes in everyday life. And between session work acts as the vehicle to do this and involves activities such as the patient keeping a diary of their worries or negative thoughts, or gradually exposing themselves to anxiety-provoking situations. Systematic reviews and meta-analyses have shown that better engagement with between session work enhances treatment outcomes, yet evidence also suggests poor engagement with between session work is common. In contrast to traditional high-intensity CBT, low-intensity interventions are briefer in nature and involve less time spent in session with your practitioner, with a greater reliance on self-help materials to deliver learning about coping strategies, which means between session work makes up a substantial part of treatment. If we think about a typical course of low-intensity treatment, which usually involves 6 30-minute sessions delivered every fortnight, on the pie chart on the poster, you can see the greater proportion of time spent on these between session activities during a course of treatment by engaging with between session work for just 10 minutes every day. Previous studies seeking to explore factors which affect engagement with between session work have produced inconsistent findings, and given the highlighted importance of between session work, it seems concerning that factors which affect engagement are poorly understood. The main aim of the PhD is to enhance engagement with between session work by firstly identifying factors which influence engagement between sessions, and secondly by understanding the reasons as to how and why these factors affect engagement. The project is split into two main phases, of which phase 1 involved a mixed methods systematic review, exploring predictors of engagement with between session work in CBT-based interventions. This review was discussed in a previous capacity building showcase, and the review manuscript is currently under revision following peer review from the journal Clinical Psychology Review. Today I wish to focus on the second phase of my PhD, which involved a qualitative study including both patients and practitioners. Although the systematic review identified some factors deemed important to between session engagement, these findings needed further validation, particularly given although the review included 59 studies, these were mainly deemed of low quality and of high risk of bias. Studies mainly involved high-intensity CBT, with only 6 studies including low-intensity interventions, and there was also a lack of studies based in the UK, meaning review findings need to be tested to see if they're applicable to a low-intensity UK context. The main aim of the qualitative study was therefore to build on review findings and explore patient and practitioner perspectives regarding engagement with between session work for low-intensity CBT-based interventions, including perceived barriers and facilitators to between session engagement. Participants were eligible to take part if they had either received or delivered low-intensity interventions in an NHS talking therapies for anxiety and depression service. Using a social constructionism approach, 46 participants in total took part in a semi-structured interview. Data was analysed using the framework approach and was supported by NVivo. While participants spoke of multiple benefits of between session work, most caveated this as something which can be difficult to engage with. 3 overarching themes appeared to centre around specificity, accountability, and prioritisation. Specificity related to practitioners being specific when assigning and planning between session work, so patients leave with a clear understanding of what task it involves and why they are being asked to do it. Additionally, specificity also refers to the way that between session work feels specific to the individual and personalised and tailored to that specific patient, as a between session work feeling generalised was a common barrier to completion. Accountability involved patients holding themselves accountable for between session engagement, taking that responsibility for action. External accountability came from practitioner reviewing the between session work in the following session, and also came from social support around the patient. Prioritisation involved both patients and practitioners making between session engagement a priority during treatment. And I've also included a quote on the poster where a practitioner talks about how a patient's socio-cultural environment can come into play, suggesting that sometimes patients might be forced to prioritise other things over between session work. In terms of next steps, findings are to be discussed with both patients and practitioners, focusing on consensus events to assess the acceptability and feasibility of recommendations to improve between session engagement. These will inform future research looking to design interventions aiming to enhance engagement with between session work. Write-up of 2 journal articles reporting the findings of this qualitative study are underway, split into patient and practitioner datasets. Thank you very much for listening to this presentation today.